Psychological therapies for schizophrenia. Cognitive behavioral therapy for psychosis, shortened to CBTP, is a combination of cognitive therapy, a way of changing maladaptive thoughts and beliefs, and behavioral therapy, a way of changing behavior in response to these thoughts and beliefs. It was originally developed to provide treatment for residual symptoms that persist despite the use of antipsychotic medication. It is based on the cognitive explanation for schizophrenia. We have a video about that on our channel which you can watch if you want more details. But, to simply summarize, the basic assumption of CBTP is that people often have distorted beliefs. These influence their feelings and behaviors in maladaptive ways. Delusions are thought to result from faulty interpretations of events. Therefore, the therapy is used to help the patient identify and correct these faulty interpretations. The desired outcome is that the patient will become better at dealing with their persistent positive and negative symptoms, and their general functioning will be improved. Patients are encouraged to consider healthier, alternative ways of explaining why they feel and behave in the way they do, and to reality test their delusions and faulty beliefs. CBTP is usually delivered on a one-to-one basis but may also be delivered in groups. NICE, which stands for the National Institute for Health and Care Excellence, recommends at least 16 sessions of CBTP to those who suffer from schizophrenia. So, how exactly does the therapy work? There are multiple stages. Stage 1. Assessment. During this stage, the patient expresses their thoughts and their experiences to the therapist. This includes describing delusions, reflecting on relationships, and laying out what they hope to achieve through the therapy. Realistic goals for the therapy are set, and the patient's current distress is used as motivation for change. Stage 2. Engagement. The therapist empathizes with the patient's perspective and their feelings of distress. The therapist wins the trust of the patient, so they can work together. This requires honesty, patience, and unconditional acceptance. The therapist needs to accept that the illusions may seem real to the patient at the time and should be dealt with accordingly. They convince the patient that explanations for their distress can be developed by working together. Stage 3. ABC. A. Activating event. What is triggering your problem? B. Beliefs. Why do you think this event happened the way it did? C. Consequences. How do you react in these situations? What impact does that have on your life, for example your behavior or your relationships with others? Stage 4. Normalization. The therapist helps the patient realize it's normal to have negative thoughts in certain situations. Therefore, there is no need to feel stressed or ashamed about them. The patient is given information that many people experience hallucinations and delusions under many different circumstances, such as extreme stress. This should reduce the patient's fear of isolation and stigmatization. Stage 5. Critical collaborative analysis. The therapist uses gentle questioning to help patient understand their illogical deductions and conclusions. Questions can be asked without distress if there is a trust bond between the therapist and patient. For example, if your voices are real, then why can't others hear them? A logical discussion is carried on until the patient begins to see where their ideas are going wrong and why they developed. Stage 6. Developing alternative explanations. In this stage, the patient develops their own alternate explanation for their previously unhealthy assumptions. If the patient is not forthcoming with alternative explanations, new ideas can be constructed in cooperation with the therapist. The patient may be set behavioral assignments,